5 questions with Dr. Ved Caculo on Carotid Artery Stenting for Stroke Prevention. So doctor, could you tell us what is carotid artery stenting and why might someone need this procedure?
So, carotid artery stenting is a minimally invasive procedure wherein we will go through the arteries of the leg or the hand of the patient, and we will insert something called as a stent in the arteries of the neck, which further on supply blood to the brain. So, if arteries of the neck say are narrowed for various reasons, then in this case we will do this procedure to make way and increase the size of the artery for more blood to flow to the brain.
What are the warning signs of a blocked carotid artery and when should a person see a doctor?
Basically, it depends on the percentage of blockage. It can be less than 50%, 50 to 70 or more than 70 is what we call severe. It can be a wide variety of signs. For example, the patient can have weakness in the hand and legs, temporary weakness which will last say for 5 to 10 minutes and will resolve soon. We call this in medical terms as TIA, transient ischemic attack. In certain cases, if that plaque which is there, basically the narrowing, it like breaks off and goes in the artery of the brain, then you can even get stroke. Or in certain cases we say something called as a limb shaking TIA, meaning the patient will just have kind of tremors in the hands or legs which will recover, which will last for say seconds or minute, and then it will recover. Or certain patients can even have blindness due to blocked carotid artery, because that narrowing that can rupture and it can go in the artery of the eye and it can block that. Whenever there is a narrowing of these arteries, it has to be taken seriously and has to be evaluated further.
How is carotid stenting different from open surgery? And what are the benefits and risks of each of them?
There are two ways by which we can open this blocked carotid artery. One is by this carotid artery stenting. This is a very minimally invasive procedure. So the size of the hole will be maximum 2.64 millimeter. So through the hand or the leg arteries, through that we will put our devices called as catheters, through which we will insert our stent or balloon, and then we will open up the blocked artery. Surgery also is an option. In fact, previously doctors used to open this up surgically. They used to make a small incision on the neck and then they used to expose the artery and make an incision, meaning cut the artery open and remove that narrowing and then stitch the wall of the artery back and then stitch the neck again. There are various differences and benefits and disadvantages of each of the procedure. Latest, there has been a trial called as the CREST 2 trial. This has shown that stenting with medical management would be even better than say surgery and medical management.
Doctor, could you tell us what can patients expect before, during and after carotid artery stenting, including recovery time and getting back to normal activities?
This is a very minimally invasive procedure, so it depends on how we go through. First, earlier we used to go through the artery of the leg. Now recently in certain specific patients, I am not saying all patients, we can go through the artery of the hand and we can do this. So in patients say where we go through the artery of the leg, patient will have to come one day prior, get admitted. We'll do blood tests to see whether the hemoglobin is good, then creatinine, whether the kidney function is good, because we will inject something called as a contrast, which is a dye which goes out of the body through the kidney. So we'll check the kidney functions, then we'll check various clotting tests if they are fine or no. Then we'll do something called as a 2D echo to see whether the heart muscle contractility is good or no. Minor tests basically, nothing major. And this procedure is done under local anesthesia in 99% of the case. We will just numb that area of the hand or of the leg wherever we are going through. With that we will do this procedure. So if we go through the leg, then usually we advise the patient to not move the leg for around 6 hours, and now we have started using this thing called as closure devices. So that 2.6 millimeter hole which we have made, we will seal off the hole post procedure. Within 10 minutes to 2 hours patient can start moving the leg, not so vigorously. And if we go through the hand, then immediately after the procedure, once we remove the sheath and we give a good compression of the hand for 1 hour, after that the patient can move.
Can carotid artery disease be prevented? And what lifestyle changes can help reduce the risk of stroke?
That is a good question. Obviously, the answer to that is there are multiple factors which can cause narrowing of the carotid artery. Just like heart or the leg arteries, any artery in the leg basically gets narrowed by the same reasons. So, various common causes we can say smoking has to be stopped. Then something called as LDL has to be brought under control. So, according to guidelines, usually you should bring it less than 70 ideally, and your blood pressure should be controlled. It should be less than 140, or in diabetics it should be less than 130, the upper limit, the systolic BP. Your sugars have to be controlled. Your HbA1c should be less than 7. Then you should exercise regularly. Reduce your oily foods, reduce salt intake. Try to eat healthy foods rather than processed foods. Basically the same lifestyle changes which can avoid a heart attack and stroke. It's all the same blood vessels in the body which supply the different organs.
You like these 5 questions with our expert and have got something on your mind? Drop it in the comments or DM us at 9850 643581. Your questions could be featured in our next video.